issues to do with gender inclusivity and equity addressed in Africa and beyond. I'm sharing my screen. So today we are going to discuss about increasing gender equity and inclusivity, focusing on the current Women in Vector Control program within PAMCA. So my colleague Emma and I are going to take us through this. So PAMCA, for those who may not know, PAMCA means the Pan-African Mosquito Control Association, whose vision is to have an African free of vector-borne diseases, and has the mission of providing an African-led platform for scientists, public health professionals, vector control specialists, affected and other stakeholders to set and drive the agenda for the control and elimination of vector-borne diseases. So we have various strategic themes. I'm going to just mention them, but we have most of this information online in the PAMCA website. So we have one of the thematic areas that we have is capacity building for vector-borne diseases and elimination. The other one is collaboration and partnership. We also have knowledge management, whereby we need to ensure that knowledge is disseminated, but more so utilized in affecting policy, and also governance and sustainability. So where is PAMCA? How many in the African region? Where does PAMCA have presence so far? PAMCA, we have about 10 to 11 countries where PAMCA has presence, but it's an organization that is growing. So we foresee that very soon we'll cover the entire region. So currently we have PAMCA chapters in Zimbabwe, Malawi, Ghana, DRC, Zambia, Cameroon, Burkina Faso, Uganda, Mozambique, Benin, Nigeria, Tanzania, and Ivory Coast, and Kenya. Actually, the first chapter to be established initially was in Kenya. So we have presence almost in the entire continent. So one of our flagship projects within PAMCA is hosting the annual conference. This brings together various scientists, various teams that work on vector-borne diseases within the African region. It does not restrict only people born and bred in Africa, but anyone else who has interest, who is all participating in the control of vector-borne diseases in the country. The annual conference is usually held between the month of September and October, and we usually communicate quite in advance to have people come in and disseminate and also provide that platform of stakeholder engagement. So far, like last year, in the year 2019, we had about 400 participants attending from almost 34 countries. So there are various projects that PAMCA is involved in, one of them being strengthening surveillance, vector surveillance systems. And this currently is being rolled in about 8 countries in Africa, with 3 of those countries being centers of excellence. Further, there is need to showcase or to strengthen genomics research in Africa, and that data needs to be utilized in advising policy or implementation of various tools. So PAMCA, in partnership with Bill and Melinda Gates and Sankar Institute, rolled out a project on Anopheles genomics in Africa, and this project is being rolled in about 9 African countries. Further, we have gene drive trainings, which have been done for 3 consecutive years, and this we have had 75 professionals being trained. Lastly, we support technical support. We offer technical support to the national malaria control programs, Like here we are seeing our team, our Director of Scientific Research and our Executive Director training and offering support in naval source management. So where did the vision of women in vector control begin? One of the assessments that was done, entomological support or capacity in Africa, was done in the year 2016-2017. And this was supported by the Gates Foundation. And this assessment showcased that actually we have underrepresentation, whereby we have about 28% of entomologists or teams working on vector control in Africa, while 72% were the male gender. So this identified that there's a gap or there's gender imbalance as far as addressing vector-borne diseases is concerned, or representation of women or other gender in the control of vector-borne diseases. Therefore, these results were presented during the MIM conference in Senegal, and this highlighted that there's need to think through how do we bridge this gap of inclusion or presentation of women in the control of vector-borne diseases. So in the year 2018, we decided to take it up as PAMCA, and we initiated a roundtable discussion. And this discussion was just to brainstorm, to think through what are the issues? Why don't we have many women undertaking or being involved in vector control activities, more so malaria? Why do we have underrepresentation? And if there's presentation, where are these women? Why are we not seeing them? Try to identify the visibility. This was in Zimbabwe in the year 2018. In this meeting was supposed to take 30 minutes. We called women together and a few of our leaders, secretariat members together, to just discuss what is the gap, how do we enhance or how do we increase visibility of women within PAMCA. A meeting that was supposed to take 30 minutes lasted the entire afternoon, 4 hours. And women shared, people shared the challenges that they were going through, the gaps that they felt that needed to be addressed, and the emotional issues that were there that were beyond even just writing or just having an hour talk. So among the issues that were enlisted were issues to do with bullying at workplace, issues to do with sexual harassment at work, whereby your senior is a male colleague and you just have to stoop low to yield into their needs or their desires for you to get even a promotion or to be given permission to be away from work or to attend a meeting such as a conference. And I remember one of the colleagues who attended this meeting shared that for the last 5 years, she couldn't be given permission to attend any meeting because she was just a woman, and they looked at her like, you're good at the kitchen and not attending such international meeting. So this meeting opened up our thinking and also provided us a platform to think through and to start looking into issues of women inclusion or women participation, to be beyond just the bookwork or to be beyond just professional documentation. So in the year 2019, which was in Cameroon, we decided to roll out a workshop on strengthening the role of women in the control of vector-borne diseases. This meeting, our mission was, which was in concurrent with the vision of PAMCA, an African free of vector-borne diseases. Our vision here was empowering women to combat vector-borne diseases in Africa. Therefore, one of the things is that how do we enact a paradigm shift? Therefore, try to see how do we create an environment that is favorable or conducive, that has structures and systems that can encourage or remove the barriers that do not support women involvement in tackling issues to do with either mosquitoes or any vector-borne diseases. So we decided to pilot a program with 20 PAMCA women champions from 20 countries with plans to scale up. So during the workshop, we had an attendance of about 50 participants, 90 applicants. But in our selection, we selected about 39 participants. And these were from 20 African countries. In Africa, we have about 52. So this was almost half. So it was a good representation. And they cut across from all regional hubs that's within the Sub-Saharan Africa, the West, East, Central, and Southern Africa. The workshop was supported by the Gates Foundation. So the objective of this workshop was to conduct a situation gap analysis of women's participation in the control of vector-borne diseases. Remember, I highlighted that we had, initially we had a roundtable discussion of 30 minutes, which took like 4 hours. And this was now to see how can we document these gaps that we see, how can we bring more women to just discuss so that we can pick up the most important issues that we are able to address as an organization. Therefore, we planned during the workshop to have practical tools that enable visibility of women in the control of vector-borne diseases. And this is mainly was focused in the African region. Also to develop a structured program that encourages career advancement, partnership and collaboration, collaborative opportunities for mentors and mentees. Those were the main objectives of that workshop. So from the workshop, as I said, we had about 29 participants, all of them women. There were various, it was a 2 days discussion where there are many recommendations that were made. Amongst them was to be able for us as PAMCA to develop a mentorship program for women in vector control activities that mainly targets women of African heritage. Because for sure, we realized from that meeting that the way a lady or a woman in African countries of a black skin is treated is different from someone else who is in Africa, yes, but their skin is not of that Africa. So how do we remove that perception, or how do we strengthen the women of that African heritage? The other recommendation was to create an anonymous platform so that women are using this platform, women can share experiences and also improve on the connections. And because we realized one of the gaps is that the women who attended this workshop could not pick or could not tell when they have a certain need or a proposal to write or a collaborator to look for, they were not able to get that linkage. So to create that connection, but also to have a platform where someone can share the experiences or the challenges they're having at workplace, or so that we are able to provide that kind of support system by peer-to-peer relations. So also the other thing was to create a community for women to remain connected. In this, the recommendation came that can we create professional networking platforms, which could be either virtually, that's online, or try to have once in a while we create stakeholders meeting where there's a face-to-face convening, or also try to have social events that encourage sharing and getting to know each other. And this is possible even during our annual PAMCA conference or any other meetings that can provide us such a platform. The other thing that was recommended, is it possible to offer trainings? And these trainings could be prioritized to be either grant writing, fundraising, monitoring, and evaluation. One of the challenges most of the women shared is that it's very difficult to attract a grant when you're young and upcoming, which I think applies everywhere, but being in the African region, it's even tougher when you don't have a very good training, or when we don't have a very good support system. So the idea was, can we develop a training program for grants writing, where people can write proposals or can write even manuscripts, so that they're able to write grants that are competitive enough and can allow them to be PIs. Yes, most women participate in projects, but we realize they are not the PI. So how can they write good proposals that can attract funding on their areas of interest? The other thing is soft skills training. This came in because most people felt that their communication or the ability to be able to share information, yes, you could be having very good ideas, or you could be having, you're able to think through issues, but articulating them was a problem. So can we have training such as communication, train on communication skills? Leadership was another one, because it was highlighted like most women do not take up leadership opportunities that come their way, because one, they don't believe that they have that capacity to lead, or not even to lead a small team, not to lead a bigger organization, but even a small team. So how can we support, or how can we be able to roll out leadership training opportunities that are cost friendly, or that can be supported by PAMCA at a free cost, and also women can be empowered through that, and also management skills. Further, it was highlighted that most women do not attend conferences, including PAMCA, because of lack of that support, lack of air tickets, lack of registration fee, lack of resources, accommodation, etc. So it was recommended, can PAMCA put in place what we call as a travel grant that women can apply, compete for it, and then they are selected to attend. One of the things that will be able to increase visibility and also give them the platform to share their research findings, and further also provide a platform for networking and partnership. So those were the recommendation. And now as PAMCA, we were able to pick the way forward from that workshop, being that, yes, we need to have a PAMCA mentorship program. Two, we need to have a capacity building network, which, as I said, issues to do with leadership. And more so, I need to emphasize on this one, confidence building, because we realize it's, yes, maybe there are people naturally born to be confident, but there's a challenge by many of our ladies in the African setup, especially because considering our culture that actually focuses on the boy child most of the time. You find that the people don't believe in themselves to be confident enough to take up responsibilities such as leadership roles, or confidence enough to even stand in front of a population or a gathering to address them, or present even just their research findings. So there is that part that was highlighted very strongly, that we need to have capacity or trainings that focus on confidence building. I already mentioned issues to do with writing and communication skills. This is also an area that PAMCA picked and would like to do it. Finally, not really finally, next was, yes, we have women in vector control at being rolled from the central level, that's the PAMCA secretariat, but we need to roll it out to various countries, because as I said, we already have presence to more than 10 countries in Africa, but we try to have, and we have champions coming from 20 countries still within the African region. So trying to roll out women in vector control activity in the various countries, so that they're able to take or come up with customized solutions for their own country issues, and also, but with the support from the main PAMCA secretariat, so that they are able to roll out and steer forward issues. So our thinking that will expand the activities that we like to do as women in vector control, and also increase the pool of women who are confident, who are trained, who are able to take up, or who are able to roll out vector control activities within specific countries. The other part that we picked as a way forward is networking opportunities. We plan to create a platform for networking, communication forums, both for professional communication forums and social, and also now putting in place the grants travel grants for people to attend PAMCA and other international meetings. That was the way forward from the workshop. So since then, actually our PAMCA women in vector control priority areas are similar to the way forward that was from that workshop. So since then, as a team at the PAMCA secretary, we came together, put up a proposal, and then started looking for support from various donors. And within the were it not for COVID, I think we could be far with this kind of strategy that we put in place. But anyway, we are starting most of these activities this year. So one of them, the mentorship program, which is structures that has 6 on mentors who have expressed interest, and also mentees who have specific needs, and trying to match them so that they are able to, there's synergy in what they want to do. And then this will be rolled out very soon, and it will be rolled out in various countries where we have our champions. So the other one is that capacity building. We look forward to train our women on leadership, writing skills, professional development, that's confidence building and coaching, and coaching on various areas. And also we tend to look at having specialized skilled courses. This could be either someone needs to be trained on vector control, or someone who wants to be trained in a certain skill such as surveillance. So next we have issues to do with networking and collaboration and visibility. This is one, we would like to recognize excellence. Remember I said earlier, most of the girls were saying, oh, we do not know where the senior women or women who've been excellent in addressing malaria issues are. We do not know where an excellent entomologist who's a lady is. So we want to recognize excellence, and this will be done for the senior and also the young and upcoming. This is just to encourage also to award excellence. So the other part is for us to develop an expertise database, which has information that is collected about individuals, so that there is an ability, if I need to reach out to someone and I want to do a proposal on a certain area, then I'm able to reach out to, through the database, contact them, and we discuss that collaborative opportunity. And also it will provide both formal and informal communication forums. So also we need to also drumbeat or to showcase what our ladies are doing wherever they are through our social media engagements, and also to help them also to utilize the social media platform. Third, we like to do the Women in Vector Control Symposia. We plan to be doing this annually if possible, but as frequent as we can, so that we tend to achieve the goal of having a large pool of women who have been trained and who are able to showcase what they're doing. Also the chapter initiative for women in vector control that I talked about, and also having a travel support for attending the various stakeholder meetings, and also PAMCA's annual conference. Lastly, for networking is trying to identify keynote speakers, because also this is one of the areas we felt that if you attend a conference, you realize a majority, 70% will be men who are giving keynote addresses. Actually 80%, saying 70 to be lenient, but also try to have keynote speakers be women, or panel speakers or session leads to be women. We'll try to advocate for that within PAMCA and whatever meetings that we are involved in. So amongst the priority is issues to do with gender policy, to develop policies, all advocate for issues to do with gender inclusivity and gender equity within the organizations where we are in. And one of the areas is that there is no reporting mechanism, or there is no areas, path that are created as far as issues to do with sexual harassment or bullying is concerned in most organizations. Yes, the documents could be there, but they are not implemented. So PAMCA will try to advocate implementation or try to come up with systems or structures that can be shared with our chapter countries for adaptation, to adapt so that they can implement a no sexual harassment, because really we found this to be a root cause of most of the hindrances of women progression within the vector control arena. So lastly, one of the areas that PAMCA speak to focus on is empowering non-professionals. Our thinking is that at community levels, we have women really doing well at household levels. When you roll out, you found that the women at community levels are the ones to receive those bed nets, are the ones to make sure the child has slept under bed net. This could be different depending on the country that you have, but what we've seen in most of African settings is that women are at the core, like they are the ones who know when the child got sick and or had fever or got infected or malaria and treat. So if they're doing that work very well, how can we utilize whatever they are doing to, apart from them doing it routinely at their homes, how can we try to empower them to generate income from the activities they are doing, such as indoor residual spraying, which is being done at various countries. Like, for example, in Senegal, they have come up with a project which is highlighting or showcasing women involved in that. So working with community to, yes, strengthen what they are doing, but also try to see how can we make it to be an economic generating activity. Also in schools, trying to do outreach in schools. Remember, this will work with partners at various countries so that we sensitize the people as they grow up on issues to do with vector control. Yes, actively doing the activities such as identifying breeding sites and destroying of breeding sites, or what you should do when you have malaria, but more so to also make entomology a beautiful course for people to take up as they grow up. So trying to also sensitize them on such way. So for us, we project success to look like having a motivated or pace-setting community of African women working on vector-borne diseases. First, second, we look at women who have managerial or leadership positions, because we want to see them at senior levels, so that if they're doing activities very well at lower levels, at community levels, then we want to look at a way of them doing the same activities at management or leadership levels. The other one is having women with soft and technical skill set. Also, women securing grants as principal investigators. Remember, I said that many women are involved in projects, but you find that they are somehow co-investigators down there, but we want them to come up and be lead on very good grants that, of course, we foresee impact, because as we project is that women are really quite efficient. I'm not saying anything about, I'm not saying that men don't do it well, but we feel that that gap that has been missing for so far, that yes, men have been doing their things very well, but we want to bring in this force of women who's been missing for a while, so that they can have synergy and implement vector control activities at whatever levels they are in. Also strengthen networking and partnership at national and global levels, because we foresee, yes, we need also in-country networking. If I'm in Kenya, I have partners that I work with, I have a team that I work with, but also there is that international working. And for this, we see that we have such kind of collaboration of that kind of a bond, then we are able to achieve more and, yes, start discussing issues to do with malaria elimination or elimination of vector-borne diseases in Africa and beyond. So the other part, increased presence of African women in the various forums, online, and also face-to-face, that's in-person attendance. Lastly, implemented harassment/bullying policies at the workplace. We like to be advocates of change, because I think issues to do with sexual harassment or harassment of women or bullying has been treated like normal, whereby people have lived thinking that's the normal. I'm always touched, I'm always abused, I have to yield for so much to be done to me. So we want to see policies implemented at workplace. So I'd like to thank you. Thanks for this opportunity to share here. Like to share that for more information, you can log to PAMCA website. And also we have our social, the Twitter, that's PAMCA_women in vector control. And also you can contact us, myself and Emma here. So thanks for the opportunity. Thank you.
Great. Thank you so much, Damaris. It was wonderful to hear about PAMCA's work. And we're excited to transition into a little bit more of a discussion across PAMCA and folks working at CCP and beyond to tackle some of these bigger picture issues related to gender and inclusivity. And for folks on the line, we welcome you to add questions, comments, areas for discussion into the chat box, or to raise your hand if you'd like to add something throughout this discussion. So I'm going to share my screen to pull up some of these bigger picture questions that come out of this presentation. Great, so just to start, and this is for both Emma and Damaris, but also others from PAMCA who are joining. And really one of the things that we really appreciate about PAMCA's work in this space is after identifying some of the gaps in this space, you mentioned really that only a quarter of people working in vector control are women. After identifying this gap, you really went through a process of listening and really trying to better understand experiences and what types of solutions might be appropriate. So what are some of the ways that PAMCA successfully implemented that process, and what did you learn during that process that might be applicable more broadly for us who are working on really wanting to think about gender and inclusivity in our work?
Okay, well, I'll chime in. I think Damaris touched on some of the ways in which we've engaged with women, but the first thing I'd like to say is that for both of us, it's a lived experience. So this is our life. This is how we navigate through academia and the third sector. So the initial idea for Women in Vector Control came from just us sharing our experiences with each other, which kind of then snowballed into the focus group and then sort of lobbying for having more space, a dedicated protected space for African women to talk about their challenges. And the Women in Vector Control I see as a microcosm of the wider issue, and which is why PAMCA was established in the first place. Being somebody who studied medical entomology many years ago, I would go to many forums and conferences, and was always astounded by the lack of African representation. And when there was African representation, there was just one or two people. And the co-founder of PAMCA, Professor Charles Mbogo, who I worked closely with to set up PAMCA. I met him at a conference on vector-borne diseases, and we were the two people of African heritage at this conference, where there were over 200 participants. And so those same issues get replicated and are even more pronounced with women. So the impetus to start PAMCA, which is how do we get more African representation? How do Africans lead the charge in talking about their own narrative and solutions to their own issues? Really, the Women in Vector Control is a spin-off of that, because even within PAMCA and setting up PAMCA, for a very long time I was the only woman involved, and there wasn't much representation from other African women until Damaris came along, which was a good 7 years after we started PAMCA. So there is this it's almost like, I feel like it's an elephant in the room. It's something that's really obvious, and we know it's there, but it's astounding that few people have sort of taken the charge to kind of address it. And so we know when we go to conferences, as Damaris says, you have very few women speaking on issues. Often when you do, it's the same woman or the same couple of women. that go around the circuit. And so how do we actually tap into wider society? And as we have started, we're looking at professional women, but we are also keen on penetrating down to the community, as Damaris says. So one of the lessons that I've learned is just to give people who are not often given the space to air their views and to contribute, give them a seat at the table, make them front and center. And it's something that we often overlook due to the way that power structures are set up. It's a legacy of colonialism and historical practices, but we really need to give that space for women to contribute. And often, as Damaris said, women are they lack the confidence, and so they won't come forward. So we have to be proactive in creating that space and including the voice of women, and especially African women, who are often have the highest burden when it comes to disease. They are the caregivers within the community. They are the ones putting up the bed nets, and they're the ones providing lots of information for all these wonderful studies that we do, but we don't often acknowledge their contributions. Damaris, I don't know if you'd like to add.
No, I think, Emma, you said it all. I think that's our drive, that's our vision, and that's our experience. Thanks.
Great, thanks so much. We really appreciate those perspectives. And for anyone on the line who has additions or anything you'd like to add or to ask of the speakers, please feel free to add to the chat box or raise your hand. And great, it looks like Danette has added something to the chat box, and maybe Gabrielle, you can take a look at that and we can circle back to Danette shortly. Great. So thinking about our work at CCP and hearing about this great work that PAMCA is doing, one of the bigger picture questions that comes to mind is really thinking about how we work together. So thinking about the role of organizations working within Africa, as well as organizations working from outside of Africa, as we think about promoting gender equity and inclusion in global health programs. And this is a broader question and maybe a difficult question, but how do you think about the role of organizations working within Africa versus without? And what are some ways that we should be thinking about working together on some of these issues?
I think it stems, the way I think about it stems from what we just talked about. So it's, you said working together. I think that's really important. We have to recognize the position that we have, and even myself as somebody of African heritage that works in Africa, I have a certain privilege being in the UK and having been born and raised here compared to a lot of the women on the African continent. So we need to look at sort of positioning and power dynamics. We also need to understand that there's lots of amazing work that's going on in the continent. There are lots of small scale community-led initiatives. How do we seek those? How do we amplify what's already been done? A lot of times there are kind of new initiatives that come in and they can completely swamp what's already happening. And Indigenous Africans don't often get that platform to showcase what they're doing. And the glory always goes to those of us who are based in the global north. So it's really about taking a look at what's happening in the continent, supporting these African-led initiatives, but also recognizing that it's not one size fits all, as we know. There are bespoke interventions that need to happen. Oftentimes, African-led initiatives feel that they have to bend or sort of co-opt those from the global north to be involved in their initiatives. But what we found from the Women in Vector Control is that African women need their own dedicated space. There are specific issues and challenges that African women face that are unique to them. And so it's really important to give that space for those women to put forward their challenges and what they're going through. And we should offer that space and work in solidarity with those women. So it's really about working in partnership, and a real partnership, mutual partnership, not a paternalistic approach, which is what I often see, which gets my goat. Yeah, I think it's really, we need to reflect on where we are, how we do things, and how we interact with African-led initiatives. It's really important that we do that and we take stock of how we're operating within the African continent, because the issue of paternalism and power and authority is really difficult. And it's often hard for women who, not just women, African scientists as a whole, if your livelihood is coming from a global north institution, then you're more reticent to speak up about things that might affect you because you're afraid of rocking the boat. I'm in a slightly different position where I don't feel I have as much of that baggage, but we really should be thinking about how we work in partnership. We don't necessarily need to create something new all the time. There's lots of wonderful things happening, and we should be working to support those initiatives.
I just want to add on what Emma said. Yeah, partnership is important, and but also one of the areas that as partners, especially working in the African region, should do is to ensure gender involvement, gender balance. Maybe the balance might be difficult considering of the culture, but trying to ensure that there's gender inclusivity, especially when you're rolling out projects in the African continent, because you realize our culture or the structures that we have are more favorable to the male gender as far as maybe taking up opportunities concerned. And if you don't become very purposive in ensuring that you have a representation of the other gender, also even the youth, you realize that it will be skewed or biased towards one gender on most of the activities you do. So I believe that once our partnership could be that, yes, we partner in rolling out the activities, but also ensuring that there's gender inclusivity or gender representation, or having systems that are also favorable to the female gender too. Thank you.
Yeah, I agree with that. And it's also not just about being tokenistic, because a lot of times, you know, we say, okay, right, we're going to have X number of women, but how meaningful is their contribution? Are we really valuing their contribution? And when we design research projects and programs, are those beneficiaries or people who are closest to the problem actually involved in the design and development of that? Or is it just we go over and we literally mine people for data, then we package it nicely and submit it for a journal article or something? And that happens a lot. So we really need to think about, okay, how do we involve women at all levels of society? Intersectionality is a thing, as well as gender. You know, there's race, there's ableism, there's sexual orientation, and all of those things need to be kind of in our minds, and we need to be sort of intentional and deliberate about being inclusive of these different women. And we're starting with professional women, but we do recognize that we need to involve women in the community, and it shouldn't just be at the end stage. It should be along the pathway of conceptualization, design, implementation, rollout, and evaluation. And I think we just need to be intentional about that within our work.
Yeah, really great points. Thanks, Emma and Damaris. And it looks like you've sparked some questions and ideas in the chat box, some great ideas from Danette and also from Grace. So I'll turn it over to my colleague, Gabrielle, who will pull in some of these questions from the chat.
Thanks. So our colleagues, Danette and Grace, have raised some good questions also. There are a lot of questions here, and so in the interest of time, I'll summarize a little bit, but if we've got time, we can certainly come back to them in more detail. So Danette is asking about your experience so far with the changes in workplace policy, especially with regards to bullying and sexual harassment targeting women. Would like to know how that experience has been so far, both implementing and enforcing them, what feedback has come, and what that experience has been like, also taking into account that these behaviors, as she says, are rooted in gender inequitable norms that go way beyond the workplace. They're part of the culture or the society at large. So any thoughts on that, on the workplace policies?
That's a good question. I would say that we're really at the beginning of this whole process. So we do recognize that it's something that we need to address. And whenever we talk about gender policy, people are like, "Ooh, this is really difficult. How are you going to do this?" But when I think about policy change, I think that policy can be done on the individual level, it can be done in a group setting, organizational and institutionally. So let's start with the low-hanging fruit. What can we do within our own setup to change the dynamics? And so in PAMCA, we have something to overcome in terms of the male representation and including more women, but we've decided that, okay, within our board, we're going to have a quota of women, and within the chapters, we will do that. And given that to sign up as a chapter with PAMCA, you have to adhere to a charter, so to speak, then that's one way of cascading those things down. So I think it's definitely something that will take time, and we are working on it. But I also think that by implementing these small-scale changes and policies within our own settings and organizations and documenting the benefit of this will also encourage other institutions to reflect and take up these policy changes. But I recognize it's a colossal amount of work. There's lots of unpacking to do in terms of cultural norms. And that's why it's important to work in solidarity with organizations that are already doing the work, but also to find allies within the workplace. We talk a lot about women, but actually change cannot happen without male involvement. So how do we also work with male champions? How do we work with decision makers who subscribe to what we want to do, who can roll out that change? And so that's how we've been looking at it. But as I say, we're just at the beginning of our journey, and it will be interesting to see how things change, but I'm confident that we will be successful at some point.
I think maybe to also add something that we've realized is that most institutions tend to have these policies, and most of them are in paper form. Yes, we are just beginning, but based on the survey and also asking and speaking and using our own experience at our own institutions, that yes, the bullying or sexual harassment policies, yes, they are there, but they are not in practice. Nothing is in practice. The reporting mechanism is not there. The confidentiality is not there. When something happens to me, I don't know who to go to or where to go to. It will take time for PAMCA to actualize this, but we believe that if we start even just by sensitizing the people we work with, the communities that we are in, to that this is not agreeable, this is not acceptable. If it happens to you, either even speak just to the PAMCA platform. I believe very soon we'll have a pool of women or even the boy child who have been sensitized on do's and don'ts. And then later on, I believe that also through the advocacy programs and our collaborators and partners that we are with, most of these policies can be rolled out up in our various setups, various countries also. Yeah, thanks.
Yes, so critical mass is really important, and that's why I think PAMCA has leverage in that we have a footprint in many African countries, and we have lots of people who are members who are aligned with our strategic objectives. So really it's about mobilizing that critical mass, working with the champions, and I do believe that will help to affect change in policy.
Thanks. Yeah, sounds like there's still work that is being done on this within the organization. Another one of Danette's questions, and Danette, feel free to type anything more in the chat box if I'm not representing or you have additional thoughts. But she was curious also around promoting vector control as a career path for young girls in any work with schools, if you've got any thoughts on that.
Damaris, you want to take that?
Yeah. I think this is one of the activities that I raised about engaging non-professionals, yes, communities, but even school programs. And we think that we can work with institutions or the education system to try and have the buy-in on having school vector control activities at school levels, but also embedded in the curriculum. It's a long-term vision, which we believe, but from earlier on, we'll start with issues to do with mosquito days, mosquito walks within schools, but also even having days that we have talks about vector control activities. And slowly we'll just try to advocate at having courses or having units that cover vector control activities from primary levels. Remember, at university levels, we have entomology as a course. But at I think high school levels, at junior graduate school, we don't have such. So we try to work closely with the education systems and also with organizations to be able to advocate on inclusion or try to have the buy-in of the ministries and inclusion of entomology or vector control as a unit or a course that is taught in school. So it's a vision that we have. I'm sure it slowly will get there. Yeah.
Thank you. And I just want to note, hopefully Emma and Damaris, you can read some of the notes in the chat box because people are really noting how much they appreciate this presentation and the work that you're doing, and just really sharing some kudos to all of the work. Looking at the time, I think we might want to pass it over back to April for any other wrap up or closing thoughts before we run out of time.
Thanks so much. And it's clear from this discussion just, how much there is to say on this topic and how really important it is to be able to engage and discuss and to learn from one another. And we're so grateful to Emma and Damaris and also to all of PAMCA for taking the time to share their work. And we hope that this is just the beginning. So as you can see, we're just really at the tip of the iceberg here. There's so much more to discuss, and we really appreciate these insights. So we hope that there will be additional opportunities for engagement or even opportunities to work together in the future. So thank you so much for taking the time to share, and thank you also to all of the participants here for your great questions and insights.
Thanks a lot.
Thanks for having us, April. It's been a pleasure.
Thank you.
Wonderful. Looking forward to future engagement.
I think
Thanks,
we need a series. It's too much to
Yes,
talk about.
yeah, we might need a follow-on presentation. We didn't even get to some of our questions. So again, I think just a sign that this is a really important topic for discussion and a lot to say.
Yeah, let's keep the communication going. Let's keep the voice out there, and let's try to work together to see how we can mitigate that gap that exists. Thank you.
Absolutely. Thanks a lot, everyone.
Okay, bye.
And feel free to stick around for a minute or two just to be able to go through all the comments in the chat box if you didn't get to, because there's so many great compliments for you. And I want to make sure you see them all.
And maybe if Emma and Damaris are willing to stay just a couple of extra minutes, if you have a question that didn't get answered, I think we can stay on the line a few more minutes for folks who have time.
Thank you. It was nice meeting you guys.
Thanks for joining.
Thanks, Carmen.
Bye.
Usually one is not able to download this, like have them I think something.
Yeah. Great. It looks like
Do you
we
mean
have
the text in the chat box to download?
Yes, yes.
I think,
I'm trying to
are you
see,
the host? April?
download the recording.
Yeah, I think I'm the host, so maybe I'll try to capture that as well as the recording for you before I sign off. And just to note, we have a few folks who are still on the line, so it looks like there might be some additional questions. So if you don't mind, maybe we'll have a little bit of additional discussion and then we can wrap up.
Sure.
Okay, wonderful. So it looks like there are still some folks on the line. If you have a question or a comment, please feel free to unmute.
Hi, this is Sarah. Thank you so much for the excellent presentation. Really made me think and reflect about the work that I do and also how I show up in different spaces throughout global health. I was wondering if the model that you have around gender at PAMCA, if you were aware of similar models in other health areas such as polio or different types of vaccines. I think it's a really interesting model, and was wondering if you're aware of if it's been replicated in other health areas as well.
I could say yes and no, maybe because we need to do a lot of checking to see. And here I'm speaking on behalf of the African continent within our African setup. So I could say yes, we do have, because there are various initiatives that are advocating for women inclusion, trying to support women in various activities. And this could be even in the education sector and other places. But within the vector field which we are in, we haven't seen yet any, but I don't want to make conclusion for other fields yet. But yeah, that's why I'm leaving it. Yes, yes, it's possible there is, but we don't know of it yet. And I'm glad to see one of our colleagues, Jesslyn, online, who's been doing our social or doing surveillance for us on the women inclusion and the equity within the African setup. I don't know if she has something to comment on that question.
Hi, Damaris. Hi, Emma.
Hey.
Hi.
It was wonderful. Congrats. It was a great conversation. And I agree, this should be a series. An hour is just too short. There's so much to dig into.
Thank you. Yeah.
Yeah, but to Sarah's point, and I'm a bit more removed from things on the front line, but there certainly isn't something of this offering for women in vector control in Africa. There seem to be lots of sort of gender-led initiatives that might target women in the community only or women professionals, but we're keen to look at the whole gambit, right? The whole spectrum. So from young girls to early career professionals, established women, and even those who have retired and want to give back. We're trying to think about how can we strengthen a pathway for women at all sectors, in all sectors of society, from various disciplines within the vector control space. But we'd be happy to partner with other initiatives that are happening. I think there's strength in numbers, and we can certainly learn from each other and complement each other.
Thank you.
I think, April, if we continue like this, we might start another discussion.
I'm game.
Yeah. No, I just asked, oh, go ahead, sorry.
Yeah, sorry. I just shared a link online of an opinion piece that has just been produced that I wrote. And my argument one on that piece is that in less than a year, we've had a vaccine initiatives or vaccines that have been approved for use for COVID-19. And we've had malaria for decades now in the African continent, but we don't have a vaccine that is used and we know that it's working against malaria yet. So my argument is that what energies do we need? What support do we need in making this a reality? So I just shared the link. Initially, I was to send it to Emma only. I realized it was going to everyone. So if you have any thoughts about it, just read through, and I'm happy to get any feedback on that opinion piece. Thank you.
Great. Maybe if we have any last burning questions for folks on the line. Looks like we still have some folks who are joining. So if you have a question or a comment, please feel free, and then we'll wrap up.
There's a comment on sharing the presentation, April.
Yeah. Okay, great. Yeah, we can share the presentation. Happy to do that. Great. Any other final thoughts?
Just great to see that it's kind of sparked conversation, and I think until we start talking about these issues, nothing gets done. So I think that the time that we're in has given us all chance to reflect on where we are in the world, what's happening with the global social justice movements, and has also given us pause to reflect in PAMCA in how we engage women. And so it's wonderful to have this conversation with you all. We hope it doesn't end here, and that we can carry on collaborating on these issues, because we do need to work in solidarity, and we need to work together to co-develop solutions in different parts of the world.
Yeah. We are happy to also collaborate, whoever who has ideas or who's looking for people to work with. We are available on also supporting these gender initiatives. And remember, it's not only talking about policy, but also issues to do with supporting on leadership, training, even technical trainings, so that we need, there are ideas that how do we change from 28% to even 40%, you know, not looking at even 50-50, but just bring that, remove that gap that is there about presentation of women in most of this activity. Change from 28% to around 40 will be great. Yeah.
Great. Well, thanks again, Damaris, and thanks again, Emma. We really, really appreciate this discussion. It's been wonderful.
Okay.
And to all of your colleagues who joined as well.
Yeah, absolutely. Thanks, everyone.
Thank you.
Look forward to
Bye. Thanks. Okay, bye.
Bye-bye.
Bye.